us, the Raymond James, and the delay of getting the report back to us was the result of the challenge of setting up how they get electronic reporting from a lab out of state that they never had. If you account for that, then our last 7 days continue to average about 30, which is a plateaued trend, a little less than before, the week before. I must caution, and I'll repeatedly caution, that this is really related to as much the test per day being done. And again, during that same week, we are seeing a pretty flat number of about 550 to 600. The trend of new cases over Tampa Bay also showed a similar uptake. Again, these are just preliminary observations. We have 60 patients currently that are hospitalized. That's down from my last report on Thursday that was 71. 27 of these are in the ICU and 12 on the ventilators. That's not much different. So I think what's looking like is that the patients are coming in, they're being able to discharge patients, but there are those that are still remain very sick, and we likely will have a prolonged hospital stay. We've had 16 deaths. 12 of these deaths occurred in those over 65, even though that age group makes up about 10% of our cases. That's a significant risk of dying of just on our small population that we've got to date of almost 15%. 4 of the 16 were 55 to 64. Again, that total makes up about 10% of all the cases. So again, they have a significant, no surprise, risk of death compared to our other rest of our population. I think it's inevitable. We will likely see deaths in younger patients. Some of the patients that are currently hospitalized with their prolonged care are in those that are in the less than 55. So it will not surprise me. I am instituting a weekly review of all of our deaths with Dr. Devers from our medical examiner, basically looking for any what I call a system of care processes, all the way from their presenting for testing or medical to their care afterwards. As a note on the testing, we have asked Tallahassee to provide us testing on all tests done in Hillsborough County, to provide us some zip code of where the person resided that was tested. And also, if possible, which they haven't confirmed, collection sites. This data is not available to us locally, and would require Tallahassee doing their own query of their data systems. Social distancing, I think, is showing both throughout the country that it can and is slowing spread. And again, I believe it is having some effect here. It is certainly protects our hospitals, healthcare workers, and has saved lives. Continue to emphasize the personal responsibilities that we all have. Mask wearing strongly encouraged. It protects both others, as I've mentioned, but can protect some of the wearers, particularly if there is mild or not significant amount of exposure. Hand washing, 6-foot distance maintaining, and no large gathering. I think we all have to accept that this is going to be our new normal. These are habits that we'll have to adopt as we live over the coming months or longer with this COVID-19, because no matter how successful we are at decreasing it, COVID-19 will remain present, just like influenza, until a vaccine is developed, and rebounds or secondary waves continue to be possible. Our hospital surge plan has been completed. Mr. Early will review that and also share a modeling tool that has been adopted or agreed upon. Update on the care coordination plan for management of outpatients. It's still ramping up. We've had real-time data for the last week on all patients that were tested at or under care of Tampa General and USF providers, and we are connecting with the community for the rest. Coordinating of discharge of patients from both the emergency room and hospitalized. We're also making progress in linking to the hospital so that they work with us prior to discharge. In fact, we had 3 examples of that over the weekend that we were assisted with them and placed in our hotel. Testing remains critical to determine what the real amount of COVID-19 is that's circulating in our community. It provides the best data to decide just how we're doing. And ideally, we're looking for sustained reduction in our cases, significant reduction, sustained over 1 to 2 weeks, and at the same time, significant increasing our testing to give us confidence. We have 2 means of testing in our system right now. Our 8-patient outpatient, Raymond James and centers such as Baycare, Tampa General, and Suncoast Tampa Family all have sites up and running. I think there are others which I'm working to identify. Hospital-based testing remains robust at Tampa General, Baycare, Advent, and HCA facilities. I will stop there with my update, Chairman, and welcome questions.
Thank you, Dr. Holt. I see no questions at this time, but one of the things I want to address, I wanted to have the 3 doctors from USF talk about the public health analysis and advice on continued community COVID-19 mitigation practices. I want to come back after their presentation, and talk about social distancing because we got some major problems that we got to face. I want this board to discuss that, but I'll wait till we hear back from them before I bring that forth. So at this time, I'm going to ask Dr. Donna Peterson, Dean, and Dr. Marissa Levine, Professor of the University of South Florida School of Public Health, and Dr. Thomas, I hope I'm pronouncing this, Nash, of the Global and Planetary Health Strategy Area Lead at USF. Good afternoon.
Good afternoon, Commissioner and the Emergency Policy Group. This is Dean Peterson from the College of Public Health. Delighted to be back with you. I'm going to say a few words, and I'm going to turn it over to Dr. Levine, who's been very heavily involved with a variety of folks at the city and the county and can update you, I think, in a more comprehensive way. But I just would begin by expressing our gratitude to all of you for making the decisions that you made, for issuing the guidance that you did at the time that you did. I think you can hear in the reports from Doug Holt and from others that we've done a very good job in this community, helping people do the right thing, behave in the right ways to help reduce the spread of this disease. I think what Dr. Holt said is very, very important. We need to sustain these efforts for a number of weeks until we start seeing the number of new cases continue to go down. When we see that happen day over day over day, and if we have the ability to test, then we will have a much better sense of how much of this virus is actually still present in our communities and help us understand when we can begin to relax some of these guidelines and move back to something approaching normal, but we are not there yet. So I'll stop there and turn it over to Dr. Marissa Levine from the College of Public Health.
Thank you, Dean Peterson, and thank you, Chairman Miller and members of the committee. I would concur and thank you all for your efforts. There's been great coordination and collaboration around the community. I'll concur that safer at home is, although not perfect, I'm sure you're going to talk more about that, There's some good evidence that it's working both locally and nationally, but we're definitely not out of the woods, and it's not a time to let our guard down. I think that it's critical to continue efforts as we've done, and also, as you'll hear in a little bit, make sure you plan for the worst case scenario, particularly around hospital and healthcare surge, hoping that we never need it. But those plans have gone on, and I thank you for doing that. I think the other thing now is really to begin thinking about that next phase of the pandemic, kind of when do we unwind this and how do we do it? And I'll get to that a little bit more. What we've been doing basically is learning as we go and then trying to adapt to what we know. Most recently, we have had recommendations about cloth mask wearing, face mask wearing, that came about specifically because of what we've learned about asymptomatic carriers and the potential for people who don't even know that they have it to potentially spread. That alone is not going to get us to the next phase. That's just another tool in the armamentarium. We really have to continue the physical distancing and the hygienic practices, because the other thing we all know is we have no treatment yet, no specific treatment, and we have no vaccine. So the next series of decisions you make will be very difficult. And I think what we're trying to do, and my colleague here, Tom Unash, will talk about in a moment to help answer questions, is provide some additional tools through modeling, which gives a more local and regional perspective. And then also, one thing that we don't really have well is what's happening in the community with people who maybe don't even show up to the healthcare system or before they show up to the healthcare system. It's important information, and we need to get a handle on it. So again, my colleague Tom Unash in a moment can answer questions about what we think is coming. There is a one-page handout that I've provided for you, which identifies a number of these things, but just to kind of close on what I think are really key considerations at this point, some that you know, and some just to emphasize, the need for rapid diagnostic testing is critical. We've heard about some of the delays, and we need to continue to push for the ability to have rapid feedback, and I'll get to why that's critical in just a moment. You've heard a lot about serologic testing. That's where we can, through blood tests, identify if people have developed an immune reaction. We still have a lot to learn about what that really means, both in the short term for people and in the long term. But we are going to need that information, particularly to help identify who might be able to go back to work as we unwind these mitigation efforts. And there's one thing that I don't think has gotten enough emphasis is, regardless of what we do both now and with the next phase, this ability to find individuals who are ill, and that's why we need the rapid tests, find them quickly, isolate them, and then do really, as people describe it, the shoe leather public health, where we identify their contacts rapidly and make sure those folks are quarantined. That's not only important now, that's going to be critical. And I'm sure we will always have limited resources to do that. But I just read this morning a report out of Hopkins about the needs to do that effectively. And it's going to require significant additional person power to do so. That's important now as we're dealing with it. It will be critical in the coming weeks. And at the end of the day, the reason we need better information about what's happening in the community is so that we could focus and target those limited resources effectively. And again, my colleague, Tom Unash, has been doing some great work with a number of individuals, and he can answer questions both about modeling opportunities, which we hope to show you later this week, and what's called syndromic surveillance that might allow us to focus those efforts better. Mr. Chair, I'll stop there.
Thank you, Dr. Levine. Dr. Unash.
Thank you. Can you all hear me?
Yes, sir.
Okay, great. Yes, thanks to Dr. Levine for introducing me. I have been working at the for about 2 weeks now on 2 different areas through the College of Public Health, and I'm going to introduce them sort of sequentially. The first came as a result of a referral that I got from Dr. Peterson to a Dr. Lester Martinez, who is a retired brigadier general from the U.S. Army. And his responsibility right before he retired was to head up the U.S. AMRID and develop a syndromic surveillance methodology to be used to detect potential bioterrorism events throughout the United States. Dr. Martinez came in contact with me and introduced me to some of the colleagues that he had down in Puerto Rico who had actually developed a syndromic surveillance network for COVID-19 for the island. And that had been picked up last week by Harvard and has been introduced into the Boston area. As you all know, probably at least the data that's come out of Iceland and Austria this morning indicates that probably we're only detecting 10% of the infections that are actually out there in the community at the moment. So the problem is really an order of magnitude greater that we're actually being able to detect right now by strict testing and hospitalizations. So getting a handle on what's going on in the community with mild symptomatic infections could be really an important factor in trying to identify how bad the problem is and also where the problem exists within the communities. So we've gotten together with Dr. Martinez and the people in Puerto Rico and have developed a syndromic surveillance package that we can actually use here in Tampa Bay. This consists of really two stages. One is a website that people can go to, and they can basically plug in their information, their zip code or their address, and what symptoms they're experiencing, their age, and other comorbidities that might be out there that would put them at increased risk. And then submit this to the site. And what we're planning on hoping to do at this point is to have people monitoring those survey results as they come in and basically make judgments for triage, either to triage to referral to medical students and medical personnel at USF Health if they are exhibiting symptoms that are characteristic of a COVID-19 infection, or providing with information that says it looks that the symptoms that you're having right now are not really characteristic of COVID-19. Please be careful and monitor yourself. And if you start to exhibit some of these symptoms, please check back with your healthcare provider or the county or whoever we decide that we can use for that. And then the back end is actually a platform that's based on an automatic GIS platform developed by the company Esri, which will take the survey data and all the information that's out there and map it onto a map of the Tampa Bay area, which will allow us to identify where the majority of these calls are coming from and allow us to identify hotspots. Can I share my screen? Would that be possible with you folks? I have a button here that says share content.
If you can, sir.
Okay, let's see if I can find this here. I'm going to click on here. Can you folks see this?
Yeah, there you go.
Yes.
So what you're looking at here is actually an example. We don't have a map for Tampa Bay yet because we don't have any data going into Tampa Bay yet. But this is actually the map that they developed based upon this survey data, and it's kept up currently on a daily basis. And this is showing what's going on basically in San Juan in Puerto Rico at the moment. And you can see if we move the map down here, this is actually looking at all the symptoms that are characteristic of COVID-19 together. We can split this out to fever alone, for example, or difficulty in breathing, shortness of breath, so on and so forth. And if we go in here and we actually expand this area out, if you hold on, I will do that. You can start to see that in this system, we can actually get down into the neighborhood level. In the San Juan area, and this is the way it will work also for us in Tampa Bay. So as the data are entered into this system, we can actually begin to get maps and heat maps of where the people who are calling in are reporting symptoms that are uncharacteristic or similar to what we'd expect from COVID-19 infections. And this can all be updated automatically and will be updated automatically every day from the survey results, and will be made available to everyone and anyone in the county, in the health departments who are interested in actually looking at this. so that we may actually be able to identify where potential hotspots for secondary waves, once we get past this first wave, are really occurring. I think this is going to be quite helpful for you folks in terms of targeting your surveillance efforts in the limited amount of testing that we're actually going to have available to particular areas and particular neighborhoods where we actually may be developing a problem moving forward. So as I said, this is right now, we will be putting this out probably, I'm hoping on Wednesday or Thursday of this week with a rollout with student volunteers at USF. Get back to the people through a call center once they enter their data, if they do have problems, or even if they don't seem to have symptomology. So we will give the people in the community some incentive and some return on the fact that they're filling out these surveys for us. And then it will also connect to this Esri-based platform and start to develop the maps of the hotspots where the calls are coming in that actually are reporting symptoms characteristic of COVID-19. And as I said, this will be updated daily. In Puerto Rico, they have somewhere north of 40,000 responses across the island to this survey so far. So the people have been pretty willing to get up and actually provide the information and give us a fairly large database. One other thing that we're trying to do as well, has been mentioned, I think, by Dr. Holt previously, is I have enlisted help of Dr. Benjamin Jacob, who is a GIS expert at University of South Florida, and a couple of student volunteers to actually supplement this with other data that potentially could come in on zip codes and reports into hospitals, call centers, or urgent care call centers, or any other sorts of data that we have, where we may have some sort of locational information that we could actually supplement the survey data with these other more passive forms of data collection and get an even more detailed map moving forward for it. So at this point in time, this is all basically ready to go. We're just trying to enlist the student volunteers and have the organization set up. Dr. Levine has been instrumental in helping us to that. And once we have that sort of back room in place, we're hoping to go ahead and publicize this as widely as possible throughout the Tampa Bay area to get people to actually start to call in and provide us their information if they do feel like they are sick and they perhaps have a COVID-19 infection. And I'll turn it over and take any questions.
Okay, Dr. Nash, thank you very, very much. Dr. Peterson, is there anything else you wanted to say, ma'am? Dr. Peterson? Okay.
Hi.
Go ahead, I'm sorry. Go ahead.
Not yeah, no, I think that's our report. We've got a lot going on at the college, working in concert with all of you in the county and the city, trying to do the best we can to manage this. But as Dr. Levine said, this is not the time to slow down. We need to maintain the vigilance, make sure we continue to educate the public, and give them every reason to practice all the good public health preventive things that will help us tackle this virus.
Okay. I'm having some problems here with my screen. I don't know what's going on. But let me ask a question here. You all have given us good information as to still we have to do what we have to do to lower this curve and have social distancing. One of the problems we're running into, and I want to ask Sheriff Chronister and Mayor Castor if they want to join in on this. I've been getting calls concerning large gatherings of people throughout the county. I think Sheriff Chronister emailed me something this morning, and if I'm reading this right, in the last 2 days in Hillsborough County, there were 24 calls on this past Saturday concerning groups of gatherings of people, not social distancing, having get-togethers, having parties in the yard, in the street, having a great time, not paying attention to the social distancing. On yesterday, Easter, if I read this right, Sheriff Chronister, you can correct me, there were 14 calls on the same identical thing. People not paying attention and not doing the social distancing, which we encourage constantly from the beginning, that this will prevent the spreading of this disease. And that curve we talked about, lowering, flattening that curve. I talked to Mayor Castor on, I think it was Saturday, that in Tampa there was a gathering of more than 100 people in a section of Tampa that was just out of control. And I think she said she was going to do some things with the police department on that yesterday, last Saturday night, if I'm not mistaken. People, we hear that this is helping, but I can tell you from what I'm seeing, people are not paying attention and they're not observing the social distancing. They just are not. And that concerns me because I think that because the mere fact is that they're not getting tested. There's someone somewhere in there is going to have the COVID-19 symptoms. They're going to spread this disease with others being around it. Then they spread it to someone else, and the numbers of those not being tested, they're not getting tested. The numbers that we're going to see either in the hospitals or in our funeral homes is going to start to increase if we don't do something. I know when we first started this, we started talking about a curfew. We backed off the curfew. My question now is, what do we do? And Sheriff, if you want to talk about this also, and Mayor Castor, you want to talk about the conversation we had, I would appreciate it because this is very, very serious. That yes, we're talking about social distancing, but there are people that just aren't doing it in Hillsborough County. Sheriff, you want to say something? Mayor Castor? Can you hear me?
I can hear you. I don't know if the sheriff, there he is. Chad, you have comments?
Yes,
okay,
ma'am.
I can go ahead. I can tell you about the city. We have had, individuals that can, as Chairman Miller and I discussed earlier, that, and I know Sheriff Chronister is very familiar with, they can text out and have 200-300 people, maybe not text, Instagram, in a location in a matter of, minutes. And so the police department did break up some locations. We have our air service flying around the city, taking photographs if they find large groups and getting officers over there to break them up. The one that we had was 26th Ave and 22nd Street. We had a large group there and broke them up. We have our Parks and Recreation checking the parks during the daytime hours. And then we have officers checking those at night to ensure that individuals aren't congregating. As you know, we have a large homeless population along Nebraska and in the downtown area. We have the homeless shelter where we have 100 individuals, but we can't force anybody into that location. And so we are breaking this up as quickly as we can identify them and find them. But as we have discussed all along, there's that level of personal responsibility. These individuals, these adults need to understand the significance of this, especially when they're living in the multi-generational homes or under those conditions where they can take this back home. And I know you have, Chair Miller, as I have, talked to a number of community leaders throughout the city of Tampa for me and for you in the county, trying to get their cooperation to preach this word out. It can't just come from city government or county government. This needs to come from the entire community. But again, we are breaking those up as quickly as we identify them, but we need the citizens to call in when they see it. And then we also need a lot of our civic leaders and religious leaders to get involved in this as well. And one of the things I would also like to ask, if the positions are still on, I think that an area we need to discuss as a next step as well, if everyone's amenable to discussing a curfew, I'm amenable to that as well. But I think mandating the wearing of masks whenever in a public setting, I think is something that we need to talk about as the next step. With the percentage of 10% of identified 10% of the cases, and that means it's going to continue to spread. I think overall we're doing a good job with the social distancing, but there are certain areas where it's being ignored, and it's being ignored in large groups, and it's mostly with the younger, that group, that generational group that we all belonged to at one time before we had too many birthdays, the young and invincible. And so we just need to get that word out to them that they can be the ones that carry that back into the home to those that can least afford it.
Sheriff, are you there? Sheriff? I lost him. think we lost the sheriff. He'll hopefully come back. But I think, Mayor, you asked a question of the doctors, either Dr. Peterson, Dr. Levine, or Dr. Unash, concerning masks, if I'm not mistaken. Am I correct?
Yes. Mm-hmm.
Yeah, I can make a comment on this. This is Dr. Unash. If you actually go to Worldometer and you search across the European countries that have had COVID-19 infections, you find that there's one country out there that actually is past its peak and is way on the downslope right now, and that's Austria. And the one thing that Austria did that was unique among the countries in Europe was they early on mandated wearing of masks when anyone was out in a public area or entering a public shop. Nothing very fancy, just regular old surgical masks or cotton masks. But if you look at the data, they have been remarkably successful at with that one additional factor in being able to really get the epidemic under control and getting it on the downslope right now. So I would very much support the idea of encouraging mask use throughout the city of Tampa.
So this is Marissa Levine. I would like to add to that. I think that clearly from a public health point of view, there's evidence that this is an important practice because you're really protecting other people, not so much yourself. And we don't know what as you heard from others, the burden of asymptomatic diseases in the community, but we expect it's there much greater than we would even know. The issue we have is that many countries, particularly Asian countries, have kind of accepted this practice, and so they do this much more routinely. You all know as well as I do that wearing masks in this country has lots of different implications historically, so it makes it a little harder here. But if everybody does it, and there's a requirement, that may make it easier. And I'll just close by saying one of the issues with the groups convening that you mentioned is, number one, young people do tend to be invincible, but also to some degree, they haven't been fearful of this because they haven't necessarily seen it like they've seen it in places such as New York. So on the one hand, that's an indication that maybe it's working. And I think that the law enforcement approach is really important to make it clear, and also for all leaders to make it clear that this is how we keep each other accountable.
Thank you very much for that. I understand that they haven't seen it like they've seen in other parts of the country. One of the things we want to do here in Hillsborough County is make sure that they don't see it. And I think the way we do that is we're going to have to some way, somehow enforce our safer at home and emphasize this social distancing. I know we talked about a curfew before and we got off that subject, but some way, somehow, this emergency policy group, later on, we needed to really have a major discussion on what can we do to stop these gatherings that we have. Specifically, Mayor talked about the city of Tampa. Her and I talked about that on Saturday. Sheriff Chronister, I don't know if he's back yet. I know he dropped off, I believe. Within the last 2 days, had 38 calls of social gatherings of sometimes up to 50 people and gatherings from the information he sent me. So we're going to have to talk about that because we're going to have some real serious issues as we go down further on this. Commissioner Merman, did I see your hand? Commissioner Merman?
Can you hear me?
Yes.
Okay. I appreciate you bringing that up because I did want to bring it up today. There are a lot more cars on the road. I think people are relaxed with the safer at home approach, and maybe they feel like, it's not going to hit them. I've seen large gatherings. I can appreciate, I'm so glad you brought it up. I do think the curfew is something we definitely have to discuss, especially from 9 to 5 or 10 to 5. I'm talking PM to AM, to allow for people to get to work because there are just way too many cars in the road, which means that people are not staying at home. And I will say this to our law enforcement, people are going faster. I have had more complaints about speeders than anything, more than the social gatherings, there's a lot more people also speeding, which means people are just, there's less cars on the road, so they feel they can go faster. So I think in the big picture of things, I think we just have to tighten down a little bit more. People are saying to me, oh, we don't have that many cases. We don't have that many deaths. They really want to be, they're relaxing their whole opinion and overview of this whole situation with the virus. They don't understand that it can break open, break loose at any minute. So I do think it's something we should discuss going forward. And I'm glad you brought it up. Thank you.
Thank you, Mr. Merriman. If we don't do that, everyone's talking about that curve. We're going to have a U curve if we don't start doing something pretty soon. Sheriff Chronister, I think you came back on. I see your picture here. Did you want to comment on the information you sent me today and our conversation we had this past weekend?
Yes, sir. And I apologize. I was good right up until you called my name, and then it just went dead and I lost connection. So I apologize, Mr. Chair. From the Sheriff's Office perspective, we've had 214 calls for service related people being non-compliant with the safer home order since it went into effect. 14, as you said yesterday, all the way up from large gatherings to a couple few individual businesses. Yesterday, we even had a report of a restaurant in Waimama that was open and had people seated sitting outside. A lot of what we're experiencing that we're seeing when it comes to large gatherings is in the afternoons into the later evenings. It's not necessarily overnight. But again, I agree with all of you. It's certainly cause for concern. It's not the 30 or 40 people that we go out and address and get those people to break up. It's someone infected in that 30 or 40 group that goes out back into the community or home to their families and continues the community spread of this virus.
Thank you, Sheriff. And again, policy group, we're going to have the rest of the presentation, but when we get to our discussion, we need to have a discussion on what can we do to curtail these groups coming together and doing what they're doing. It is out of hand, and I understand that some people feel that they're insensible and it's not going to affect them. But if we don't, we talk about that curve going down, we're going to have a U-shaped curve. It's going to be down, all of a sudden it's going to spike again, and that's what we don't want. That's a U-shaped curve. It looks like the Omega sign. We don't want that. We don't want that. Sheriff, thank you very much. Commissioner Overman, you're recognized. Commissioner Overman. Let's move on to Ms. Stively. Ms. Stively, you're recognized.
Thank you, Chair Miller, and I appreciate some of the comments that have been made. That 10% statistic is definitely a concern, and I concur with some of the comments that Commissioner Merriman has made and you have brought up as well, Chair. I think it's a question of also continuing to educate the public about some of the information that we are discussing on these calls and some of the information that's being presented to us, because I think if the public had facts and data, perhaps they would reconsider some of the social gatherings and some of the practices and the habits that they have in public. One question I had, I don't know if this would be for the health professionals on the call, but if there were a mandate or some type of order with regard to wearing masks in public, would there be enough supply of those masks, and where would citizens acquire those masks? Looking just as we were talking, I was checking to see how quickly I could get a mask from, for example, Amazon.com, and the earliest I would get it would be at the end of May, meaning that I can't leave my house without a mask or with a mask on until the end of May if I can't get it sooner. And is there going to be an issue with the demand of that and taking that away from the medical personnel that might actually need it more than citizens do? Just a question for conversation and discussion, and maybe to get some information from our medical professionals. Thank you.
This is Marissa Levine. I can begin to address that. It's an important question because anytime you mandate, obviously, you want to make sure people can comply. But I don't think you can assume that the resources to purchase or acquire them is going to be adequate. And we've seen the federal government has even resorted to putting videos out about how to make your own mask with what you have at home. I think that's the only way it would work. So people will have to use what they have. And we absolutely have to leave the masks for the first responders and the healthcare personnel. I'm talking about the commercial masks now.
Just jump in here. This is Dr. Unash again. The surgical masks that are generally used in Southeast Asia, in Asia and various other places really aren't super effective. They're blocking about 80% of the particles that can move through. The N95s, of course, the 95 means that it blocks 95%. But a study has shown that just sort of a t-shirt that's folded over or a handkerchief that's folded over 3 or 4 times or a closely knit scarf will block somewhere a little bit north of 50% of the particles. So a homemade mask is not ideal. It's certainly not as good as an N95 mask, but it's approaching what those standard surgical masks that are out there actually do. And if everybody wears them, even if we're only blocking 50% of the large particles that go through, it's going to have a dramatic effect on the transmission. So I would, I think it depends on how you market this thing. If you market this, everybody should be wearing this, but don't worry about getting a commercial mask. You can make one at yourself at home in 30 seconds by folding a t-shirt across your mouth. Everybody's got t-shirts, or most everybody, I think, has t-shirts anyway.
Okay. We'll come back to those discussions as a group later on. Again, let me thank Drs. Peterson, Drs. Levine, and Dr. Unash for being on the call. You don't have to leave. Please don't leave. We may have to ask some more questions of you. But I want to thank you for your presentation concerning all the different subject matters we brought forth. We're now moving to the emergency management update. Mr. Dudley.
Good afternoon. Tim Dudley, County Emergency Management Director. First, let me start by thanking this emergency policy group for your leadership and recognizing that we have a long way to go through this. With that being said, the team continues to work hard here at the EOC. Our current actions is we continue to support Raven James remote collection site. We'll start up again tomorrow. As of 1 o'clock, we currently have 411 appointments scheduled. All persons interested in being tested should call the triage line at 813-272-5900. There's no cost for the testing. The county remains ready to stand up additional sites as needed. We continue to support operations of the county quarantine and isolation sites. Currently, we have 2 guests at the quarantine site and 14 guests checked in at the isolation site. This past weekend, Tampa Hillsborough Homeless Initiative, Affordable Housing Service, and Homeless Services donated Easter gift baskets for guests at the Q&I sites. And we appreciate the community support for our citizens there that are recovering. Just wanted to let folks know as a reminder that outside access is restricted on the property to certain times for our guests. And this is to prevent direct contact with hotel staff who are dropping off meals, laundry, and conducting scheduled general area sanitizing. If guests leave the site without coordination with our command team out there on the site, they will lose their slot and be reported to the Department of Health. So this is just another reminder, letting you know that we do have precautions in place, but we do have folks afford them the opportunity to come out, get a little fresh air, but they're restricted to the property. We continue to coordinate logistics, receiving, staging, and distribution of critical supplies. We have 1,438 requests that have been filed with the state. We have distributed in mass 124,000 masks, and that's a combination of the surgical and N95, face shields, 6,800, gowns, 4,200, goggles, 1,689, and gloves, 107,000 pairs of gloves. We continue to operate the donation management warehouse at 250 West Shore Plaza to receive medical supplies donations from the community, and we operate from 9 a.m. to 3 p.m. Monday through Friday. I do ask that you continue to support that site. We still need supplies, as this will not be over anytime soon, and we can greatly appreciate getting those supplies to the folks who need them the most. We continue to work with partners to develop a plan for unaccompanied minors requiring quarantine and isolation support. We continue to support plans for in-home testing for vulnerable populations who are transportation challenged. And we also continue to prepare to open and support alternate care sites as needed. Additionally, 2 Hillsborough County libraries are offering drive-through pickup and drop-off of reemployment assistance applications, 9:30 a.m. to 5 p.m. Monday through Friday. It'll be at the Jan Platt Regional Library at 3910 South Manhattan Avenue and the Jimmy Keel Regional Library at 2902 West Barris Avenue. Also, our emergency support function, 18 Economic Development, they've been sending out materials to advertise their business and employment help. You can visit hcflgov.net/stay-safe to see this information. You'll see you can provide assistance paycheck protection program for small business loans. Also, the SBA Economic Injury Disaster Loan Emergency Advance, and also the SBA Express Bridge Loans enable small businesses who currently have a business relationship with an SBA Express lender to access up to $25,000 quickly. And the Economic Injury Disaster Loan Emergency Advance Program provides up to $10,000 of economic to business. So I encourage all those business owners to visit our website at hcflgov.net/stay-safe to see how we can provide any assistance that you may need. And this concludes my update. Any questions?
Thank you, Mr. Dudley. Mayor Lott, you're recognized.
I'll wait till we go to discussions to have my comments, okay? Thank you.
Okay, thank you, Mayor Lott. Commissioner Overman, you're recognized.
Thank you, Chair. I got disconnected earlier, and this relates to actually both the previous public health officials as well as Mr. Dudley. Thank you both all for your reports. I am really excited to hear about this internet sort of way of doing some surveillance. I think it's an excellent way of helping people recognize that there is hotspots in the community and it could be in their neighborhood. And I think that would be much easier to really surveil and get more information until we're able to really do a robust testing situation. If I'm not mistaken, I think Dr. Yunesh indicated that someone could go online and fill out the survey, because can they also call in if they don't have internet service, was one of my questions. And then how do we get this information out to the public so that they know they should call in and gather that information and help provide us a way of showing where it is in our communities?
Dr. Yunesh.
Yes, your first question is the survey that we're putting to the smartphone component. So you can enter it on your phone as well as your, if you don't have internet access, you can go on and do it that way as well. As far as publicizing that, we had a meeting about that on Friday afternoon. I am looking for all the help that I can possibly get to get the word out on this. I am as I said, I am farthest from a marketer that you can possibly imagine. The only thing I've ever done with marketing was 40 years ago, try and advertise a 1974 Chevy Nova in a classified ad, and I got no bites. So I'm not a very good marketer. I really need help with marketing, and I think we could use all the help we can get.
I think we lost his audio.
Yeah, okay.
Can you hear me?
Are you there?
I'm here. Can you hear me?
Okay, go ahead. Sorry.
Sorry, I'm having to hold this thing up to my face. It's a bad connection. I was saying, yes, indeed, when we create this, the survey, it's going to be not only internet-based, but also you can do it as a smartphone app. So you'll be able to do it off a phone without an internet connection as well. And as far as marketing goes, I basically have no experience with marketing, and it's probably not something in my personality. And I would be grateful, and I think the College of Public Health and everybody would be grateful for as much help as we can get on getting the word out on this into the community. So anything you could suggest or any help you could give, I will be eternally grateful. Thank you.
I'm very glad to hear that. The issue we've heard is, a lot of young folks are invincible, or at least perceive that they are. And, if we said we have currently 95 cases from the ages of 15 to 24 and 134 cases between the ages of 25 and 34 of the 770 in our county. That's not a small number. They may not be dying, but that's a significant number. And every one of those cases that may have needed to wait 2 weeks, the 50 that got the test that we had to wait 2 weeks to get the results back, may not have realized that they were contagious as much as they needed to be, and may not have isolated in a way that they may need it to be. So I agree, the mandatory masks, it would be a really great thing to consider moving forward. And if there's a way that we can do that, or encourage all of our business owners to require it to enter their business, that might be one way to do that. With the testing that we're doing through Raymond James and others, as far as Mr. Dudley is concerned, we have the ability for people to call in and get access to a test. But I also am curious about whether or not it's possible that when someone calls for an ambulance, but then they're they don't really want to go to the hospital, but they are exhibiting symptoms of COVID ID, can our fire rescue folks actually test them instead of having that delay occur where they need to wait till the next day and call in and then get an appointment and, make sure they have the testing available? I wasn't sure where we were with that process. Mr. Dudley, can you help with that one?
Yes, I don't want to steal Mr. Early's thunder, but he'll be following here shortly. But
he's going to be following up with testing information on the agenda later on.
And I'd also like to take this opportunity that the Joint Information Center can assist with getting the messaging out and supporting the survey.
Mr. Merrill, did I see your hand?
Dr. Unesh, could I make a comment here about marketing to the young people who think they're invincible? The message that's really gotten out, unfortunately now, has been that the death rate in this is very much skewed towards the older population, which is absolutely true. The younger people generally are not dying from this infection. However, if you look at what's going on out there, a lot of young people are getting really, really sick. And, getting the message out that, oh, I'm invincible, this is not going to kill me, is very different than if you can get a message out that says, yeah, it won't kill you, but if you get this thing, you're going to be flat on your back in your bed for 2 weeks. If you really want to do that. Maybe a more effective way of reaching the younger population than just saying, the message out there, which is, you're not going to die from it.
Okay. Mr. Merrill, did I see your hand? Mr. Merrill?
Sorry.
Mr. Merrill?
Tim actually covered it. We learned about Dr. Unesh's survey over the weekend, and we are preparing to push the message out through our Joint Information Center.
Okay. I also just received a text from Santiago Carrata from Visit Tampa Bay that they're willing to do whatever they can also and pushing the message out. Okay. Let's see. I thought I saw someone else's hand. Ms. Snively, is your hand still up?
Yes, thank you. Thank you, Chair. We talked a little bit on the last EPG call about the grab and go touch points. I think Commissioner Overman actually suggested a way of efficiently collecting information or getting information out to people who are taking advantage of our nutritional meals. And I did have a discussion with the superintendent about how we can push information out to families about county services that are needed. And because we're trying to minimize some of those touch points, we originally talked about maybe handing out a flyer to the families as they were coming to get their meals, but maybe a better way to reduce contact with families might be to use our social media platform and our communication platform with the school district. If we can partner with the county to, push information out about testing sites and housing assistance, transportation, utilities issues, mental health services, all of those things. We have 220,000 students and 25,000 employees. So you're talking about, 250,000 people that we might be able to help with the reach in getting some of this communication out. And so I believe the superintendent is very willing to partner with the county on this as well to help get that information out.
Thank you. Thank you, ma'am. Okay, we're going to move now to federal and state legislation updates. Mr. Wagner.
Good afternoon, Mr. Chairman and members. This is Brandon Wagner, Chief Government Relations and Strategic Services Administrator for the county. I'll start with our federal update. This past Friday, the U.S. Treasury and IRS announced creation of a, quote, Get My Payment web application that's going to be unveiled on this coming week. Its intention is to allow taxpayers who filed their tax returns in 2018 and 2019 but didn't provide their banking information to do so in order to get direct deposit. This will allow them to receive their funds quicker instead of having to wait for checks to arrive in the mail. Again, it's available through irs.gov. Folks should go onto the website, read the materials, and apply as appropriate. A couple of key caveats. Once you are scheduled to receive your payment, you cannot change your account information. And the IRS is stressing the security issue. If you get contacted by the IRS, it's not from them. It could be a potential scam. So people need to use diligence and caution as they work with this system and make sure they get their payment appropriately. Another benefit of the program is it allows people to track the status of their payment so they have some certainty into which it will arrive. Next, today was when we expected guidance from Treasury on the $150 billion state, local, and tribal relief fund within the CARES Act. We were updated this morning that guidance may not come now for a few more days. We will continue to closely monitor Treasury and push out the information that we receive to you as soon as it is made available. We would advise responding to it quickly as the time frames may be narrow, and we'll certainly want to qualify for those distributions as soon as possible. No further progress was reported over the weekend on additional legislation or funding at the congressional level. Republican leadership continues to push for only the $250 billion additional funding through the Paycheck Protection Program. Democratic leadership wants to add in $100 billion for hospitals and $150 billion for state and local governments, and the boost in food funding assistance. Negotiations will continue. We anticipate there will be 2 floor sessions in the Senate this week, so opportunities continue to exist for action, but it has not yet been taken. Of note, half the funding for the PPP has already been allocated, and it is reported that they could exhaust all remaining funding by this Thursday. So there'll be pressure on Congress and the administration to act quickly. No current updates at the state level. And with that, I conclude my report, and I'm happy to answer any questions that you might have.
Thank you, Mr. Wagner. I don't see any questions at this time. Thank you very much for your update. Appreciate it. Project updates, Mr. Early.
Yes, sir. Good afternoon, Mr. Chairman, members of the Emergency Policy Group. This is to address the other part of those people that needed at-home testing. This is a mobile testing solutions that we've developed. The county will utilize a combined approach that will include a provider and transport provided by the Sunshine Line, use of an EMS strike team, other transports to the collection site, and an appointment-based system to assist and schedule those residents for test collections that are homebound or without transportation. Generally, patients would call into the centralized call system and make an appointment to be screened as they are doing today with patients. If the patient answers yes to the screening criteria and they're without transportation or homebound, the call center would then coordinate a time, go to the patient's home and make them outside to collect the swab. If required, they would also go in the home to swab the resident. To ensure that there's an increased access to our diverse and vulnerable populations, the county will establish sites to facilitate test site collections at 3 of our community resource centers, similar to our Healthy Living Program events. These will be Lee Davis, South Shore, and Plant City, using the same process we do at other test sites. As with all the test sites, kits and PPE are essential to the ongoing abilities to provide this limited service. We would continue to ensure we follow the DOH process for requesting the kits and PPE in all cases, like Raymond James Test Site and the federally qualified health centers that we're currently using that are homebound and without transportation would require screening to ensure that criteria is met. In coordination with our partners, we're going to continue to ensure that the actual clinical flow and that of the clinical protocols are followed to manage the patients at home as appropriate. I'll stop there. Any questions?
Thank you, Mr. Early. When did you say that was going to start?
We're going to try to get everything started in place later this week.
Okay, thank you very much. Commissioner Overman, you're recognized.
Yeah.
Commissioner Overman, you're recognized.
Thank you, Chair. Thank you, Dean. I really appreciate hearing that. I'm glad we've got, the mobile thing moving, and I do appreciate having those community centers activated. I didn't get a chance to really ask this question earlier, and this is going to become more important to you as far as PPEs and given what we need in the way of supplies, and now that people are looking for masks, how are we doing not only with available testing available, but also the PPE equipment necessary for not only all of our network, all of the first responders, but now this new team that needs to get out there that also might have to go into someone's home and need to make sure that they keep their family safe when they do.
Well, we're doing some more inventory of the PPEs and the test kits, but I believe that we're going to have enough to do what we're trying to do right now. We're going to continue to need more, though, as you use those up.
Okay. Thank you, sir.
And,
thank you very much. Now, does that mean that we're going to partner with Fire Rescue to possibly ask them to do a test if someone appears with COVID ID, or is it only going to be Sunshine and you mentioned a strike team, and I broke up a little bit.
Yes, ma'am. I am going to work with all of those groups to try to get that done. So in other words, we might use some of our EMS providers. We might use some of our civilian groups. It just depends on what our demand is and what particular places are available. We're also going to do some, like at the community resource centers. I've also started talking to the federally qualified health centers and the public health department to help us as well.
Okay, great. And in the screening questions, are we asking them if they have a car, or do they understand that they have to come in the car alone in order to be able to get tested?
Yes, ma'am. I started looking at that criteria and we finally developed it. I eliminated the part where you take a friend takes you there because it's just too difficult. So basically we're going to use a very short criteria to try to establish that this is for a person that's homebound and a person that has transportation. But we would not exclude them, other than that reason.
Okay, Mr. Early, you want to move into update on alternative hospital surge capacities?
Yes, sir. I am pleased to report that the county's alternative care site plan is now completed. This could not have been accomplished without the joint and unified cooperation of the 4 Hillsborough County healthcare systems, TGH, Baycare, Advent Health, and Hospital Corporations of America, and their CEOs. Their appointed senior representatives have worked with the county administrator, the county Department of Health, our USF specialty advisors that you've heard on the phone, and the EOC team such as Tim Dudley and Jay, to successfully develop the Unified County EOC and partner-developed ACS plan. The ACS plan outlines how Hillsborough County will establish and support alternate care site operations during the current COVID-19 pandemic. Utilization of these measures may be necessary as part of the disease intervention strategy. This will be a living document that may need to evolve and change to meet the demands of the current response. This plan was developed in accordance with the Florida Department of Health Alternate Care Site Operations Guide, as well as Florida Department of Health Alternate Care Site Local Plan Development Guide. It provides guidance for the establishment of alternate care sites for use during the COVID-19 pandemic. This plan will focus on the provision of necessary medical care to those infected with COVID-19 who can be cared for outside of a traditional hospital setting but are not able to self-care at home or at one of the county-managed isolation sites. The logistics, operational, financial, and administrative components of this establishment of this site will be reinforced with this document in this plan. The management of the facility will be a joint venture between the Department of Health and Hillsborough County through a unified command at the Emergency Operations Center. Support in the form of staffing, materials, services, and other needs will be supplied by local hospitals, vendors, and contractors. Patients sent to the ACS will come exclusively from a hospital following a joint assessment by the transferring hospital and the Department of Health. The length of stay for individuals placed in these facilities will be determined by the Department of Health and the provider responsible for their care. Individuals who are ill with COVID-19 could take up to 30 days to recover before being discharged from the ACS to step-down facility or home. This site may be operational for an extended amount of time, to include weeks or months until the needs of the community are met. The decision to activate an ACS or an alternate care site is based on reaching predetermined hospital capacity levels. Predetermined separation and initiation points of the plan include 70%, 80%, and 90% of the target ICU maximum bed capacity level. The plan leverages the 4 healthcare system hospitals in Hillsborough County, and then it further leverages the other hospitals in their system before seeking additional resources outlined in this ACS plan. An ACS can either be an existing brick and mortar structure or a temporary field hospital type facility. And the county and Department of Health have made arrangements for both options. And I'd like to thank Mike Merrill and Greg Hordell for their support during this process. Finally, the Unified Alternate Care Site Plan members will continue to meet weekly to respond to situational changes and will utilize the monitoring tools we've discussed today, in addition to the state models, to ensure up-to-date reviews at the local and regional levels with summary reports are provided to the emergency policy group. And as a reminder, those account USF Syndromic Surveillance Platform, US model for local regional pandemic modeling and establishment of a community report at the local level. I would also like to take this opportunity to acknowledge the following individuals: Carrie Eisenbeis, Brent Garnishell, Aaron Skiba, and Belinda Grant. They are the 4 senior representatives from the 4 healthcare systems. They have been impressive, and they have done a wonderful job of doing a unified approach to this plan. The independent specialty advisors, such as Donald Peterson, Marissa Levine, John Curran, and Dr. Unash, are Donald Mullins. And I can't say enough about the Department of Health for Dr. Douglas Holt and Ryan Pettico, and the EOC team, such as Chief Jones, Tim Dudley, Anaki Rizzola, Raymond Hansen, and Jay Raja have been great. And I can't tell you that this has been a village, a team approach, and I'm very pleased to say that it's completed. I'll take any questions and I'll stop there.
Thank you, Mr. Early. Thank you for all that you're doing. I know you're working around the clock on so many different areas of this whole situation. We want to thank you so very much, and thank you for all your staff and those that you named and others that are working with them to get these things done. Commissioner Merman, you recognize.
Thank you, Mr. Chair and Jean. I'll echo Commissioner Miller's comments. Your team has been stellar in the response. I just want to ask you one thing. So we have 67 people in the hospital right now. We have a few more in the ICU. Will most of those 67 go into the step-down units? Is that how it works before they're released to go home, or how will that happen?
I'm going to let Dr. Holt answer that question. Dr. Holt?
Dr. Holt, you still on?
Okay. I think
The way that would work is these hospitals would identify their lower acuity patients to go to the alternate care site. They have a plan for expanding their actual ICU capacity, which is going to be one of our triggers, is as they approach their daily. We want to clear out those lower acuity individuals who we can get out of there with minimal maintenance at an alternate care site. We're not looking for complex or a medical surge type of patients.
Okay, great. Good.
And Commissioner,
Okay.
Commissioner, just one more thing.
Okay.
You can still hear me?
Yes, sir. Go ahead.
This plan is designed to be the one where it's the worst case scenario. This is when they've filled all their capacities. This is when they've leveraged all their current hospitals and current maximum resources in the system. And at the points that we're talking about, that's when they would activate this site. So we hope we never have to use it, but you have to have a plan like this in place in the event that you do. So I'll stop there.
Commissioner Miller, if I could just mention one thing too. Dean Early has made available the Hillsborough County Healthcare Plan to those that are in crisis. So I think, to help short term, but I think it's really going to go a long way to help those, especially the emergency cases. So
Again,
thank you.
Thank you very much for all that you've done. Appreciate it very, very much. Thank you. We're going to now move into the EPG group discussions, and I'm going to start it off, ladies and gentlemen. When we first started this entire process of talking about leveling the curve and making sure that we kept 6 feet apart, we went down to 10 people in gatherings, and we've gone through many, many scenarios since that time. One of the things we continuously emphasized was having the social distancing, the safe distancing of 6 feet apart, and the gathering of people in large numbers to make sure that we would not have the spread of this coronavirus disease. Unfortunately, it is not happening. The sheriff sent out some information to me today, and we just talked about the number of cases that he had, number of calls he had on Saturday, which was 24, and on Sunday, which was 14. But I just went back and looked, and they're averaging about 10 calls every day of people social gathering, from children gathering in a playground, number of people in the street. We're not only talking about adults, we're talking about children also. And we're also talking about, I got a text from City Councilman Goose. We're talking about people even having house parties. I've talked to some police officers that people are having parties in their yards during the week. They're not paying attention. They're not listening. I don't know if it's how much more education we can do. You hear it on TV. You hear it on the radio. You hear it from us that you must not have these large gatherings, and you must have the safe social distancing. I don't know what else we can do. At this point, I know we didn't want to talk about a curfew when we first started, but I think the time has come. No, I don't think the time has come that we need to look at putting a curfew in place every day. I know that Ms. Beck and her staff had put together a curfew piece for us early on. I don't think we can wait any longer to Thursday or next week in talking about this. We must do something today about these social gatherings and people having parties, people coming together and not paying attention to what they're doing, or maybe they just, I don't want to say they don't care, but they just think they're invincible, like some of the doctors have said. We can't allow this to happen any longer. Our numbers are going to get worse. Our deaths are going to get worse. our hospitals are going to get filled. We can't afford to do that. So, ladies and gentlemen, I'll put a motion on the floor. We're going to have discussion. I'm going to pass the gavel to Commissioner Overman as a vice chair. I'm going to make a motion that we establish today a curfew in Hillsborough County every day from 9 p.m. to 5 a.m. Every day curfew from 9 p.m. to 5 a.m. That's my motion.
Thank you, Chair. Do I have a second?
I guess I didn't get a second.
I don't hear a second yet.
No, I didn't get a second.
Commissioner Merman seconded it.
Pardon me?
Thank you, Commissioner Merman provided a second. Any discussion?
I see Commissioner Mayor Lott had his hands up.
Mayor Lott, you're recognized.
Mayor Lott?
Was there a second?
Yes, there was.
There was a second. Okay.
Mayor Lott, Commissioner Merman provided a second. You're recognized to speak.
Okay, thank you. I think what I've really loved about this EPG more than just the task that we put in hand is how democracy has worked here the way it's supposed to work. And I have a lot of respect for everyone on this board. And I think the meetings twice a week, we've proven to discuss things in detail and to come up with actions that so far has proved well for our county. With all due respect, I don't support a curfew. And the reason why is I believe that that the plans that we have put in place has done well. I don't think we should relax anything at all. I don't believe we should pull back anything we've done at all. I think we need to keep everything and every decision we've made and keep them full in force. And but if I look at the numbers and if I look at the calls that have come into the sheriff's department, I know the numbers we've had into our police department. I think the system is working. When we get those calls, you know, we're responding, and we're a lot of the times that we're just having to educate those individuals on what the rules are, what they couldn't do, what they can't do. And for the most part, we know we have those that want to obey and follow the processes we put in place, the steps we put in place. But you're always going to have those individuals that are going to stretch it to the limits. And but the nice thing about what's happening is that our citizens are responding and are making those calls and let us know where we have organizations, individuals that are not abiding by it. And responding in those educational matters, people, once they know what the rules are, they're responding. And so I would hate to see us to put 1.4 million people under a curfew for, you know, the few hundred calls that we've received so far, you know. And my fear is that we're going to put 1.4 million people under a curfew, and we're still going to have those same couple of hundred calls. And we'll be in the same situation we are right now. We have to go out and educate or actually enforce what we put in place. So I respect the motion. I respect the second. But I believe that we would be causing more harm than good. I think we should be, saying thanks to our public, thanks to our citizens for them taking on the CDC's rules, the tasks we put in place, and I don't think we're rewarding them for the good efforts in our community by putting a curfew in place for 240, 250, 300 calls, whatever it has been since we put this in place over the last three to 4 months. So I will be voting no on this curfew. Thank you.
You have Mayor Castor.
Mayor Castor, you're recognized.
Sorry, I didn't know my hand was raised. It must have been from before, but I'll weigh in as well. You know, our safer at home order basically says, you know, it's in lieu of the curfew and it can be enforced, but we were looking at it through an education and encouragement. But I have to agree that if the law enforcement has the curfew as a tool and we don't make, so many exceptions to the curfew that in essence it's unenforceable, then I would vote for it. And I think that probably for a couple of weeks, that is a good idea, just so that the law enforcement officers have that tool at their hands and they can break up these gatherings much, much easier. So I vote yes for a curfew without all of the stipulations that we have or exceptions, I should say, at the safer at home order that we have in place right now. That's it. Thank you.
Commissioner Merman.
Thank you, Mr. Chair. I'll just go ahead and speak. Actually, when I first brought this up several weeks ago, it was easier to go to the safer at home, but I think the two work hand in hand, and that's why I think this policy is so important. As long as the exception is in there for people that work, that don't get off work, like your Publix guy that, he's stocking the shelves till 10 or 11 at night, and things like that. And I think that's just common sense, and I'm sure law enforcement would recognize that. But I do think they work hand in hand. And if we have to get the message out because people aren't listening to please stay at home, then they will in this other hand, because they know law enforcement will show up and tell them, you need to break it up and get home, and you're breaking curfew if you don't leave. So I think the message is going to be loud and clear, and everything we do at the Emergency Policy Group is flexible in some ways and can be changed, in 2 weeks, like Mayor Castor just said. So I think it's a common sense approach to have these work hand in hand with each other. Thank you.
And Madam Vice Chair, what the same curfew that was drawn up by Ms. Beck and her staff is the same one we will utilize. The only thing we'll do is change the time from 9 to 5, because we're finding out that a lot of these gatherings are starting very early. And so that's why I pushed it back from 9 to 5 instead of from 10 to 5. So it will be from 9 to 5 with all the exceptions that we had in there concerning people going to work and bus drivers and transportation folks. That's what it is. Ms. Snively is next, Commissioner Overland.
Snively, you're recognized.
Thank you so much. I think that some great points have been made with regard to the curfew. I think that one of the reasons that we chose to do the safer at home was not to to put too many restrictions at one time on the community. I do believe that a curfew could be helpful for a short period of time to hopefully curtail some of the extracurricular social gathering activity that's happening in the evening of our young adults. My question would be to law enforcement as to whether this would help with law enforcement as far as giving the law enforcement obviously more authority, or would it be a hindrance to the resources that are available for law enforcement? And so, sorry, Sheriff, I don't mean to put you on the spot, but I do really appreciate your opinion where this is concerned, because law enforcement is plays such a significant part in something like this. And so, do you have enough resources for this, or is this going to hinder your resources as far as law enforcement is concerned? Thank you.
Sheriff Chronister.
Mr. Chair, okay. Thank you, Ms. Vice Chair. I think it all comes down to restricting movements. How restrictive do we want to be? Law enforcement's been extremely active, focusing on our educational efforts. Yes, we have that small portion of our population, for whatever reasons, not complying with the safer at home order. The good news is when we approach them, they disband. The bad news is, from talking and listening to all the medical data, is these people are infected. Yes, they may only be a 34-person gathering that we're dispersing, but if they're infected and they return back to our communities, how many additional people are they infected when they're with us at the grocery stores or anywhere else that we may be in a common place. So being the protection business, I would certainly always err on the side of caution. Like I said, the good news is a lot of people, once you speak to them, they disperse or they're even gone prior to our arrival. But I think this group has a difficult decision to make, and it's how rapidly do we want to stop or prevent the spread of this coronavirus, COVID-19. If we want to restrict movement even more so, then I would say let's all vote in favor of the curfew, and we will start focusing more on the deterrent. I think when you put out a curfew, I think it sends almost a louder message, a more clear message. I would hope so anyway, that individual know, hey, listen, we need to stay home. The safer at home order, they still feel like they can go out and their movement's not as restricted. Soon as you say curfew, more people are going to take that to heart, and hopefully that will help us flatten that curve that much sooner. So in essence, it's not any more work or less work with law enforcement. I know we've been really focused, like I mentioned, on being preventative and focused more on education. And most people have been compliant once we speak to them. I know the Plant City Police Department had to effect an arrest over the weekend. I look at the arrest every single day, and I saw that Saturday they had to arrest an individual for having a large party. I don't know the details surrounding that, but they had to effect an arrest for someone who was being non-compliant. I can tell you that if our focus here is to restrict the spread so we can return to that sense of normalcy when it comes to living our lives, I'll certainly be voting in favor of Mr. Miller's motion as well.
Thank you, Sheriff. Commissioner Miller, are there any other hands raised? I'd like to ask a couple of questions.
That's it.
Okay. With that being said, I did want to ask you, Sheriff, a couple of questions, and then we'll take a vote. For the individuals that work at night, I mean, I don't know if you've done sort of an analysis about when there's been a problem, but if in the evening has been where we've seen that problem, like early evening till 5 a.m., my question is how will law enforcement work with those that work the night shift and work in our factories and stock our shelves and are working in our hospitals and showing up from 11 to 7 a.m. and sometimes have to leave early or pick up their kids to go to daycare? Those are the things we were concerned about before, and I think those concerns still not yet need to be addressed before we pick hours. If moving it to 9 p.m. addresses the fact that young people have parties earlier than later, that's something to consider, agreed. But if our complaints of people gathering and not keeping the social distance are, in the afternoon, on the weekends, during the day, then the hours don't matter. So I'm curious if in looking at your arrests or complaints, does the 9 p.m. to 5 a.m. sort of justify those hours when it comes to a curfew?
Thank you, Commissioner Overman, and that's a great question. I can only speak on the Hillsborough County Sheriff's Office, and looking at the data of the 214 complaints we've got since we've implemented the safer at home order. Most of them have been predominantly in the evening time, some during the day, some in the evening. We haven't had a ton of complaints with the overnight from that 9 to 5 time period. But again, I can't speak for the city of Tampa, Plant City, Temple Terrace, USF, or the airport. I'm not sure exactly what they're seeing. I can certainly research that and make contact and report back to you. As far as any type of movement at night, if you have a logical explanation of why you're out at night, I don't think those are the individuals that anyone wants to target. We want to target those individuals who are just being non-compliant with any type of order and in turn putting themselves and others at risk.
All right, thank you. Thank you for your response.
Commissioner Overman, Mayor Ross's hand is up.
Mayor Ross, you recognized?
Thank you, Commissioner. I had my hand raised, but I'm having trouble with my camera, so I don't think it's coming through. So in In terms of the curfew, I certainly defer to the majority of the EPG and support the collective decisions, but I do have to question the effectiveness of what we're proposing. And I know with the curfew, a couple of weeks ago, I was arguing in favor of the curfew, and many EPG members were opposed to it because of the connotations of the word and how draconian it seemed to the community and overbearing in a police state and so forth. And now, a couple of weeks later, we're back in favor of it. And that's okay as circumstances change. But at this point, I question the effectiveness of it because we've heard that the majority of these gatherings, which, by the way, I completely agree, we need to try to figure out a way to discourage and disrupt these. I'm fully in agreement with that. But we've heard that most of these gatherings are occurring during the daytime and in the evening, which aren't going to be affected by the curfew anyway. And even to a larger point, these gatherings are already against the law. They're already a violation of the Safer at Home order. So I'm not sure I understand how creating another law is going to encourage people to obey the current law. And I'm not sure what we're going to do with violators that we can't already do. And so I'm concerned that this is going to have a disparate impact on the rest of our community who is already by and large observing the orders in place. And if somebody needs to go out at 10 o'clock at night for something that's currently considered an essential business, they need a gallon of milk or whatever the case may be, they're allowed to do that, but under the curfew, they won't be. And these are people that are already obeying the law, trying to do what they need to do. Maybe they're working odd hours, they work evenings, they work nights, and now we're going to restrict their movement when they're not the problem. The problem are the people who are obeying what is already in place. So I have a little hesitancy voting in favor of this since what they're doing is already a violation. And it doesn't seem, now if this were happening at 1 or 2 in the morning, I guess maybe I'd feel a little differently about it. But I'm not sure that I see making this a violation of yet another law is going to impact the already illegal behavior. It's only going to impact those people who are obeying what's currently in place. Thank you.
Thank you. If there are no other comments, any other hands raised, Commissioner Miller?
Yeah, my hand's up, Madam Chairman.
Okay. Mayor Lott, you're recognized.
I have to concur with Mayor Ross's comments 100%. You know, and every time we make a decision here, there's unintended consequences. And I'm sure glad that the sheriff shared the information that the hours that proposing here is that's not when the occurrences are happening. And thanks, Madam Chairman, for bringing this up as well. You know, we effectively have a curfew in place right now with our stay at home, our safer at home policy that we have. Okay. You know, if we're, you know, I would hope that we're not putting greater restrictions if someone was pulled over, okay, for an after hour or whatever, that would be any different than what we're doing right now. There's supposed to be an essential worker and seeking food, working in a job place right now. If you look at the rules that we're talking about, that would be in the curfew, is virtually the same rule, just that now we're putting time limits on it. So it's almost like we're putting a law on top of a law, which I don't know if I understand how that would be more clarifying to our public. That to me would be causing a lot of confusion to our public, as well as you know, our neighboring counties. A lot of the workforce travel into 24 hours a day into the county and out of the county every day. And I just really do believe that we're creating, right when things are getting normal, we have our public, by and large, is obeying the rules and the order that we have in place. We're always going to have some individuals that are not going to. I think if we respond the way we're responding, our numbers will continue to look well like they are right now. So with the numbers heading in the right direction, to me, that gives us that validates that we've made good decisions before, and we just need to continue what we're already doing. So I sure hope that we don't put a curfew in place of our citizens. I think our citizens would be outraged for their good conduct that they get charged with a curfew for a very small percentage of our population that are going to, you know, break the rules no matter if we have a curfew or not. Thank you very much.
Thank you, Mayor Lott. Are there any other hands raised? Any other comments?
I did. It's Commissioner Merman.
Commissioner Merman, you're recognized.
Thank you. I remember when I first brought up the curfew a couple weeks ago, and we got the order back, and actually the paragraph about the curfew is pretty plain. I mean, simple. It says residents are permitted, however, the unlimited ability to get the necessary food, medicine, and essentials. So the guy delivering the meals, the Uber driver, Uber Eats, whoever it is, they can still, and they're permitted to recreate and enjoy the outdoors at any time as long as the physical distancing is observed along with the other recommended sanitary requirements. And I think the reason the curfew is so important, it has a tougher stand to it. We are in a safer at-home policy. Listen, I remember when my daughter was growing up, and I would tell her, honey, you're safer if you just do this. Well, if I didn't just tell her she can't, she would think it's safer and she would go ahead and do it anyway. It just has a harder message to it. And I think what we're seeing is that people are kind of testing the limits of safer at home. So they're going past the limits. And yes, he only got 24 calls. It could be 48 tomorrow night. It could be, 50, 75, 100, but there are too many cars on the road at night. There are too many people that are just testing the limits of safer at home. If it said stay at home, yes, it would be a much tougher message, but we're saying safer. And I think the curfew kind of puts the teeth in it to make it a little more, I don't want to say restrictive so much, but it just has a tougher message to it. And I don't think much is going to change. The curfew will tell the people that are breaking it that they can't be in their cars out doing partying and going to each other's homes or going to the park or wherever they go. They cannot do those things between 9 and 5. So I think, we make a good case for it. I just think it has a much more definitive message to it going forward. Thank you.
Commissioner Ullman, Sheriff Chronister.
Sheriff Chronister, you're recognized.
Thank you, Madam Vice Chair. Yeah, a comment and then a quick question, if I may. Commissioner Merman is exactly right. It's about messaging. I don't think you're going to see much difference between our safer at home order and our curfew. It's going to be more in the messaging. We're certainly going to have to look, since they both mirror Broward County, exactly what type of restrictions we want to make sure that we're indicating in our messaging. Secondly, I had a quick question, and this might be for the county attorney. With the governor coming out with his order saying that there could be no orders to supersede his, nothing could be more restrictive. Would this be a violation of the governor's order?
Argument. So, Mr. Chair, it's Jenny Tarr. Christine had to step away for another business matter. So I think what the sheriff is asking about is specifically going back to the preemption argument. And there were some issues and elements of the governor's order that kept everything to the governor's order. But on other areas, he did indicate that you could be more strict as long as it was in the area that he had not legislated in. So I think the curfew could be appropriately added to your order.
Thank you, Ms. Tarr. Are there any other comments?
Mayor Castor.
Mayor Castor, you're recognized. Mayor Castor, turn your mic on, please.
Sorry. Thank you very much. My position before was that I would be in favor of the curfew if it didn't have all of the exceptions that the Safer at Home has, because in essence, we're, as was stated earlier, we're putting one order on top of the other. And if there's no difference then other than saying a curfew as opposed to the title of Safer at Home, we have the same thing. So if we're putting a curfew in place from 9 to 5, then it needs to be for those essential services, that you're going to the pharmacy, you're getting something to eat, you're traversing to and from work, but you don't need to be recreating and, you know, gathering in groups more than 10. So I think that it does need to be more restrictive than the safer at home.
Commissioner Miller, what did you have in mind as far as the language on the curfew?
The language I'm suggesting the curfew is more restrictive. From 9 to 5, if you have to go there's something essential that you have to go to the pharmacy or pick something up that is essential, that's what you do. Other than that, no, it is a curfew from 9 to 5 and restrictive. And I wanted to say something at the end. I think Ms. Navi had her hand up. But that's my thought process on the curfew. It's more restrictive. And I like to close before we vote. Ms. Navi, I think has her hand up.
Ms. Snively?
Thank you, Madam Vice Chair. I think that, again, good conversation, good discussion on some of these points. The issue that I am concerned about in this is the redundancy of the additional restriction. If it's already in place, I can understand why it could be confusing to the citizens to have another restriction placed upon them. If it's an issue of messaging and it's an issue of education, maybe that's the angle or the direction that we should start from, because I think that adding additional restriction to personal freedom is going to be a challenge for for law enforcement and for the community. And so I tend to agree with Mayor Lott and Vice Mayor Ross that this is it could be considered redundant. And I think that's why we chose to do the safer at home and not with the curfew a few weeks ago when we had this discussion. So I understand the desire to curtail some of the recreational activity out there, and I think it's sad that that we've gotten to this point where citizens are not taking personal accountability and responsibility for themselves. I'll be honest, I'm on the fence on this one just because I'm not in favor of necessarily restricting more individual freedom, but I understand the implications if we don't restrict movement for COVID-19 and spreading that around. So I tend to fall on the side of safety and risk averse by nature. So I think I would have to support a curfew in place that has some teeth in it that would hopefully curtail some of this activity that is problematic for our citizens, and hopefully revisit this on maybe a weekly basis with this group to see if the message has been loud and clear and if any activity has been curtailed by doing something like this. Thank you.
I don't think I see more hands.
Commissioner Miller, do you want to wrap it up?
Yes, I do. Ladies and gentlemen, I appreciate all the concerns and the debate that we've had. Let's be real serious about this whole thing. We've seen the calls.
Commissioner.
Pardon?
Oh, excuse me, Chairman Miller. It's Jenny Tarr. I just wanted to make sure and clarify for the record that following up on Sheriff Chronister's comments as well as Mayor Castor's, that as far as essential activities that the governor has indicated and listed in his order capturing the Homeland Security document as well as the Miami-Dade, that we cannot be more restrictive, but as to other areas, we can. And he specifically says in his order that social gatherings in public spaces are not essential activities.
Okay, so what are you saying?
I'm saying as far as the essential activities, we cannot be more restrictive, but on the other areas that we can for the enforcement of those.
Okay, all right. Okay, so I'll continue. We're trying to save lives. It's not about anything of trying to put a law on top of another. It's not about trying to send a message. We have had calls that come in that have been documented, but we still have more and more people that are out there socializing, having parties, doing whatever they want to do, that maybe the sheriff's department or the police department are not being able to see or hear or getting calls on. In Tampa, on 26th Street and 15th Avenue, 26th Street, there were more than 100 people gathered at one time in one place. That is absolutely absurd. And there are others that are having some of the same things going on throughout Hillsborough County, that putting people's lives at risk. This is about saving lives, ladies and gentlemen. This is not about people. I mean, you talk about freedoms, yeah, I understand freedoms and freedom of speech and freedom of being able to move around. But when you're talking about some of the calls that I've seen that we had on here that came in after 10 o'clock, that was logged in. They're not even talking about those that weren't logged in. We're talking about those that were logged in. We're talking about trying to flatten that curve. And the only way we flatten that curve right now is that we're going to have to be more restricted than what we are. There's too much freedom. People think there's too much. They have more freedom to move around and do the things that they want to do, and that is what's going to happen to us. Yeah, our numbers are where they are right now, but ladies and gentlemen, if we continue to see what's going on, if we continue to have the same socializing, gathering, having parties, in the street playing basketball or whatever the case may be, those numbers that we say are looking good are going to start to surge. Our hospital beds are going to become less and less. We won't have the ones that we need. And the testing is going to prevail, that we have more and more people with the COVID-19 coronavirus than what we anticipated on having. And we're going to really, really in a bad situation. If we put this in place for 2 or 3 weeks and see what happens, let's do that, at least do that. So we can see what's going on to see what happens with this, because if we don't, we're going to have some real serious problems. And I'm asking you to please, please put this in place, and let's see what happens with those numbers so we can curtail or stop the numbers that I think is going to happen if we don't. And that's what my closing on this. I ask you to support it.
Okay. Claire, can we call for the vote, please?
Miller?
Yes.
Overman?
No.
Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
No.
Lott?
No.
Snively?
Yes.
5-3. Okay.
Motion carried 5-3.
Thank you. Any other discussion by the group today? Any other discussion? Any other matters that come before us today?
Commissioner Miller, I have a question, another for future discussion.
I'm sorry, I understand what you said.
I apologize. I had a couple items to bring up for future discussion.
Okay, you recognize.
Okay, great. Thank you very much. As we've done a lot of good work working with our utilities and water and trash, things like that, I'm finding that there has not been a policy by our internet providers as to service disconnections. We've had individuals say, you know, I can't pay my cable bill, I can't pay my internet bill, and it's about to get turned off, or it's just been turned off because of lack of payment. Do we have the ability to negotiate with our local internet providers to see if they would suspend disconnections through this time period? And if so, can we consider that at the next meeting?
Mr. Merrill, who's been working with the internet providers, Frontier and Spectrum?
Yeah, I've got someone on staff who can make the inquiries. I think largely it's going to be, you know, those providers taking the initiative and voluntarily providing that option. So we'll take a look and bring back something to you on Thursday.
The reason I brought it up is that there's so many of our households that do have internet service are absolutely dependent on being able to connect to their schools or connect to our messaging. And while it might be helpful to be able to get some of our messaging through a phone, when it comes to our children that are trying to connect with their teachers, internet service is critical. So I just thought if there's a way we could at least negotiate with them and ask if it's a way of addressing that, that would be great, and bring that back at the next meeting, if possible. Thank you.
Okay. Anyone else have anything else to discuss? Well, we could bring to the table to discuss.
I do, Chair Miller.
I'm sorry, who was that? Okay,
Mayor Castor.
Yes, recognized.
Thank you. One of the things that I brought up earlier was the mandatory wearing of masks, and I would propose that we pass an order for the mandatory wearing of masks. As the medical personnel stated earlier, that we've only diagnosed approximately 10% of the population, and that, as we've seen from other countries, we could have a majority of individuals contracting this virus. And the two things that show an incredible effect on flattening that curve are the social distancing and the wearing of masks in the public.
So you want to, excuse me,
Yes.
hold on. You want to make that a motion, Mayor Castor, that we have it mandatory to wear masks?
Yes, sir.
Is there any other language you want to put in there as far as you want?
No, I would say that, right, mandatory wearing of masks during essential service, the grocery stores, pharmacies, whenever coming in contact with other individuals.
Is there a second?
Commissioner Overman will second that.
Okay, we have a motion by Mayor Castor, second by Commissioner Overman concerning the wearing of masks as you do your essentials movements. Is there any discussion? Commissioner Merman, do I see your hand?
I'm not going to talk unless I have something I just wanted to bring up after this is over.
Ms. Nyby, do I see your hand?
Yes, Chair. Just concerned about the enforcement of it, that's all. I mean, now you've got, people who may or may not be wearing masks. We would have to get, obviously, everyone educated on this particular order. They would have to have some, maybe a little bit of time to prepare themselves for it, to create masks at home if they have materials to do that. But then what happens, walk me through it. What happens if someone goes out into public and they don't have a mask on, or if they go into Walgreens and the store clerks are not wearing masks? Can you please walk me through the repercussions of that? Obviously, when anyone's spreading further disease, I get that. But as far as law enforcement goes, what's that look like?
Do you want me to?
I'm sorry, Mayor. Go ahead. I'm sorry. Mayor,
Okay.
yes.
The way that would look would be the same thing, the safer at home, that law enforcement approach that through education and encouragement. And really a lot of that education and encouragement would come more so from the locations that they're going into, public places like grocery stores, pharmacies, banks, clinics, and other essential businesses, takeout from restaurants, when caring for someone who is sick or has other health issues, in places where there's more than 10 people present, or when using public transit. And that comes from Osceola County. Those are their standards. And I would admit that we should adopt those. And then again, through the enforcement and the encouragement. And even, I saw the other day on the internet where somebody was making a mask out of a bandana, a coffee filter, and 2 hair ties. So, those things are available, and we could even provide that as an educational component of it. We've had the majority of the individuals complying with the at-home order, and I think the same thing would come from this. It's just that a lot of our citizens may not understand the significance and the impact that wearing a mask could have for our and could have on flattening this curve. It wouldn't be something that individuals would be cited for. It would be more of an encouragement and education portion.
Mayor Ross, I'm having
a follow-up question.
Your hand, but you recognize me. I'm sorry, Ms. Nowdy, you have another question?
I just had a follow-up question on Dr. Castor's. The order from Osceola, does it require essential workers to wear masks as well? Are employers going to be required to provide masks to all of their employees that are coming in contact with public?
Yes, they do to take some steps, where a lot of the grocery stores have the guards now. physical barrier between the clerks and the customers, but then to provide those masks as well. And I have heard anecdotally, I haven't talked to them personally, but I have heard that the stores are ready to do that. I don't know why they haven't taken the step themselves, but in the other areas that have adopted these standards, they have provided those masks for their workers, and that the local, some of the local merchants are ready, the chain stores are ready to put that in place now.
One more follow-up question. I'm sorry.
Go ahead.
Mayor Castor, when would your proposal or your order, when would it go into effect?
We could make it effective, since this is Monday, we could make it effective, say, on Thursday. That way we would have the number of days to be able to let everyone know, to educate them, and then provide those tutorials on how you could make the mask necessary.
Thank you very much.
You're welcome.
Mayor Ross, you recognize.
Thank you, Commissioner. I'm in favor of this. I think that probably the most susceptible time anybody has right now is going to one of those essential businesses, the grocery store, the pharmacy, and those types of things. And I think that this is a rather mild inconvenience that could yield big results. So I think this is a great idea. The only concern I would have, or only request I would make, is that in terms of essential business activities, I think I'm in favor of this with no problem. But under the list of essential activities, recreational activities, there are some things that are permitted that don't lend themselves to wearing a mask very easily. For instance, if you're out for a run and you're by yourself, it's not easy to run with a mask on. Or if you're bike riding and you're by yourself or you're with your spouse, it's not easy to do cardio when you have a mask on. Fishing, if somebody's in their boat and they're out in the bay and they're fishing and they're with their family and they're not around anybody else, I think, so I would request that perhaps there be some exceptions under the essential activities tab, not under the essential business tab. Thank you.
Mayor Lott, I see your hand. Mayor Lott?
Motion, was a part of that motion when that would occur, when that would take effect?
I'm sorry, I didn't hear. Say that again, Mayor Lott.
Curfew, when does that take an effect? I don't remember that being a part of the motion.
Immediately.
The curfew?
Immediately.
Immediately. Starting tonight?
Tonight.
At what time?
Motion. 9 o'clock.
9 o'clock tonight. Okay. Far as the mask is concerned, okay. I want to make sure I'm clear on this. Okay. So when we're saying that, are we saying that anytime you leave the house, you have a mask on? Or are you saying that when we're going to a place that's essential, like a grocery store and so forth? Or I just want to make sure that if I'm going out and working in my yard, if I'm going taking a walk down my sidewalk, okay, where is the breakdown to when I can leave my house and wear a mask and when I can't, when I don't have to wear a mask? Can you explain the difference there?
Yes, common sense would prevail on it. Like the instances that I read out earlier, if you're going to the grocery stores, those pharmacies, those essential services, when you're coming in contact with others. And then clearly it wouldn't apply when you couldn't do it with ease. For example, if you, what Andy Ross had to say as well, you're out running, you're riding your bicycle, you're doing those things where you're not within 6 feet of another individual. So clearly if you're working in your yard or you're walking down the sidewalk on your own, or you're out in your boat by yourself, those types of scenarios would not apply.
But if I'm in the boat with my wife, we'd both wear a face mask.
Well, I think that, that kind of goes back to sense, Mayor. I
just want to make sure, because these are real life.
My dermatologist would tell you yes, but if it's your wife, you're going to be in close proximity to her anyway, so that you wouldn't be social distancing the entire time with your family. So I think the point is you're out in the boat and you've got you're outside in the air with individuals that you would be in close proximity with in any instance.
Is there an age limit on this? I know you mentioned Osceola County.
Yeah, Osceola County says nobody under 2.
Okay. Thank you.
Okay, I don't see any other hands that are up. Ms. Snively, you recognize.
Would you be thank you for recognizing me. Would we be able to, I don't feel comfortable voting on this today without seeing, we've already seen an example of the curfew, but we've not seen an example of this in writing. I'm curious to view Osceola County's order. Is there a way we could vote on this after we actually review what the order would look like, as opposed to doing it prior to that, and maybe vote on it on Thursday? If it doesn't come back, or it doesn't start till Thursday anyway, then maybe we vote on it Thursday and put it into effect and have, some public outreach and communication about it before we take action on it. I'd really like to see this in writing before I vote on it, if possible.
Mayor Castor?
I'm good with that. I think, I would like for us to start with this today, because I really think it's the second half of the social distancing as far as flattening the curve. So would we be able to pass this around? And I guess what I would ask is there a feeling that the majority are in favor of this, so that we could socialize this and market it out to the public and then put it in effect on Thursday? If we send around the exemplars from other counties and what have implemented, and just to get everyone to feel comfortable with it, because I think the majority here are in favor. So I don't have a problem waiting till Thursday. I would like it to go into effect no later than Thursday, so we can get individuals.
So, Mayor, let me get an understanding. Are you asking for the vote to be taken today but take effect on Thursday?
No, what I'm asking is that if we socialize it around, like, in other words, get the community ready for it to understand it, because I would hate to put it in effect on Thursday without educating the public first. So my point is, between now and Thursday, we could send all of this information around to the EPG members, but also get this information out through the JIC to the community to understand the value of wearing this mask. And then we could put it in effect immediately, and it wouldn't be a surprise to the public.
Okay, so what you need to do, from what I'm hearing, is withdraw your motion to have it effective, to make it mandatory, or somewhat mandatory, with a mask, and then ask our emergency management communications folks to get this information, or Mr. Merrill's staff to get this information to our EPG members, and then also get the message out, whatever means necessary, to folks, to let them know what we're talking about, and maybe they can comment on it some type of way to us, so we can be ready to talk about it again on Thursday. I think that's the best approach to have.
Yes, and would like to, remove the motion, but vote on it on Thursday and put it into effect on Thursday as well.
Okay. I know everyone understands you withdrawing the motion, but we're asking staff and Mr. Merrill to get this information to the EPG members, and to get the information out to whatever mechanism we may have that we're discussing, discussing wearing of masks, specifically when you go to essential areas. And then we come back on Thursday, have a discussion on it, and possibly vote on that at a particular point in time. Everyone clear on that? Okay, very good. Any other business to come before us?
I have my hand up, Commissioner Miller.
I thought that, Commissioner Maria.
I just want to let everybody know, this is definitely related to this pandemic, but it's our job loss. And right now we're sitting at $38,500 people who have unemployment claims. And this has tripled over the last 3 weeks. And I really think it's important for this committee to understand this and understand the perspective of what the impact has been on this community going forward. So they're working very hard. Actually, the claims now are being processed faster because of the introduction of the mobile app, but obviously there's a lot of catch up that they have to do. So I wanted to give everybody that information so that they would have it. And when they're thinking about some of these policies they're putting forward. Okay, thank you.
Commissioner Berman, that up. You gave a number of those that have filed a claim. I saw a survey this morning that said 1 in every 4 persons in Hillsborough County have lost their jobs or been furloughed. If that's 1 in every 4, that's over 362,000 people that have lost their jobs or furloughed in Hillsborough County. Over 362. They said 1 in every 4. That's a lot of people. A lot of people.
A lot of people.
Okay. Anything else coming for us today? Anything else?
Commissioner, be recognized, please.
I'm sorry, who's that?
Commissioner Overman.
Okay. Commissioner Overman, you recognize?
Yes, hi. I thank you very much, Chair. In light of the conversation we just had about masks, I think it would be great to ask communications to put out a request for any and all businesses that have the capacity for creating or making masks for our citizens. And we have a few days for a company to get used to that. It'll give some folks some time, because I will tell you, I knew that I had planned on going out to run an errand on Saturday and tried to put together one of the handmade masks and on Friday, and just felt completely inept when I couldn't get it done. It was just, put me in panic mode that I thought, this is an essential service. I should be able to do this. But putting that mask together wasn't necessarily one of my strong suits. So what we don't want to have is families that feel like they're trapped in their house, they can't go anywhere, or they just feel inept and feel making a mask. And we do have a lot of folks out there right now that are willing to help, that are willing to make masks, that have the capacity for doing so. So in that communications about the importance that we will be adopting on Thursday, mandatory masks for anyone that's in a public setting. It will do 2 things. It gives people time to get ready. It gets people time to step to the plate to assist in creating masks for our citizens that may not have the tools or the skills and to get it done. But it also sends a message to our business owners. We have a lot of essential business owners that are not providing masks to their employees, where they come in contact with large numbers of people. And I think this is an important thing for us to do. But we do need to make sure that they have access to the resources, where they can call to get, masks, or how they go about acquiring masks in the event that they need a large number. So if someone can help us be best prepared for that communication on Thursday, I'd really appreciate it.
Okay. All right. Seeing nothing else to come before us.
Mr. Chairman?
Sam? Yes.
This is Gene Early.
Yes, Early.
I got a communication from Dr. Peterson, and I wanted to read it just to make sure. Please make sure that the order refers to cloth face covers, not masks. She's very afraid that people will start back ordering masks and further delete the supply needed by our healthcare workers and first responders. You can say that people are ordered to mask, meaning the verb, which can be accomplished by any type of face covering rather than mandating a mask, the noun.
Okay. All right. I think staff has that. Everyone understood what Dr. Peterson was talking about? Okay.
Yes, sir.
Thank you. Ms. Snively, you recognize.
Thank you, Chair. Last question. With this curfew going into effect tonight, what are the plans to communicate this out to the community effectively in this short period of time that we have? Thank you.
I'm going to ask our communications people with in the emergency management office to get that press release out as soon as possible. Right after this meeting, I always have a conversation with the press. I can guarantee you they will be on there to talk about it. The information will be out probably as fast as I can get off this phone and we talk to them in our 6 o'clock news. Anything else, ma'am? Ms. Navely? Anything else? Okay.
Yep, thank
I'm
you.
going to ask, you're welcome. Mr. Brewer, could you get with Mayor Ross and work out, I'm having some problems seeing him when he put his hands up. I'm not seeing it on my screen. I'm having to get a text from Mr. Merrill saying Mr. Ross's hand is up. I don't know if it's a problem with my computer or his computer with the city of Sample Terrace or whatever. We can work that out before Thursday. I would appreciate it very, very much. Can we do that, Mr. Brewer? Mr. Brewer. Okay, well, I'll get with him later on.
Commissioner, this is Andy Ross. I'll speak with him.
Okay.
He just contact me, I'll contact him.
Yeah, because I'm having a problem. You were raising your hand, and I wasn't able to see it on the screen.
Yeah, I don't understand what's going on because I had an earlier call and the camera and the raise your hand and everything was working. And then when I came on this call, it's not. So I'll fix it. I'm sorry.
Okay. All right, very good. No problem. No problem. No, just want to make sure you're able to do that next meeting. There's no other
Mr. Miller?
For us? Yes.
Yes, Attorney McElroy, Communications. We'll make sure we get with Mayor Ross to get that straightened out. We're discussing it right now.
Thank you, sir. I appreciate that. If we have no other business coming before us, we have another meeting on this coming Thursday at 1:30. And with nothing else before us today, we'll stand adjourned. Be safe. Thank you.
All right, thank you.
Thank you.
This is a chart of the 2008 financial crisis. Over the course of 517 days, the stock market dropped by more than 56%. Millions of people lost their jobs, their homes, and their life savings. It was the worst time for the global economy since the Great Depression. Now, this is the 2020 economic collapse so far. Over the course of just 21 days, the market has dropped by roughly 20%, the world has seemingly shut down, and we just might be on the worst economic trajectory in history. So how did we get here, and what could we expect going forward? Well, let's start off with the first part. You see, the first thing, as most of you know, is that there is a global illness going around that many people are worried about. And from my previous videos, you might know that my position on this is that if you get the disease, you will almost certainly be fine, but it is disproportionately bad for the elderly and those with underlying health conditions, such as myself. So it's good to be cautious on a social level, but also there isn't a need for you to panic on an individual level. Initially, when the disease had its first outbreak in China, it caused the Chinese government to shut down its manufacturing sector in order to help prevent the spread of the virus. Now, that wouldn't be a problem if 1/3 of all products weren't made in China. You see, China is the global supply chain of the world, so when China experiences delays in production, the entire world's economy experiences delays as well. Now, I made a whole video on this, which you can check out on my channel, but I won't dive into deep detail in this video. But anyways, because of the supply chain slowdown, we have seen many large companies experience a slowdown in their sales and revenue. And that makes sense because if you don't have your product to sell, well, then you can't make any sales and can't make any money. And here's an example. The car industry is very dependent on tools, die, and machinery in order to manufacture their cars. But each one of these necessities for the car industry is experiencing a 1 to 3 month delay because of the Chinese shutdown of the manufacturing sector. Now, this means that car companies will not be able to launch their new annual vehicles on time, therefore missing out on billions of dollars worth of sales. And also, because people are being asked to stay inside, they're missing out on some wages, they're trying to be cautious and work from home if possible. Because of those things, we've seen an 80% drop in automotive sales in countries like China. And this effect trickles down. You see, if car companies are seeing a drop in sales and revenue, then so will its suppliers. And if the suppliers see a drop in revenue, then so will the raw industries that work with the suppliers. And this effect radiates to all other companies that are connected to the automotive industry. And what else happens when a company sees a drop in sales or revenue? Well, we tend to see things like layoffs or even bankruptcies. And those things lead to a higher unemployment rate, which would lead to less purchases being made by consumers.